Good afternoon, my name is Jürgen Steinmetz with breaking news from eTurbo News in Honolulu. Looking at the Seychelles right now, there has been a discussion today by the World Health Organization why there was a double increase in numbers of COVID-related infections in a country that is pretty much vaccinated almost all of their people. 65 or 68% of the people in the Seychelles were vaccinated. 35 or more percent had received a second shot, and the vaccine was Sinopharm from China. There has been discussions in the past about the effectiveness from Sinopharm, and even Chinese officials said there is room for improvement, and Sinopharm wasn't as effective as some of the other vaccines. Now, what does it mean for the Seychelles? Seychelles is a country that lives on travel and tourism, and it's extremely important that this country is safe for tourists. And Sharon Francis, the CEO of the Seychelles Tourism Board, said that Seychelles remains a very safe haven for tourism, and that the Tourism Board is doing anything they can possibly to keep it like this. Now, listen to the World Health Organization and to the statement, what they're saying. The alarming part is that a lady who received 2 vaccines, a 48-year-old lady in Seychelles, just passed away after receiving both doses. But all the other cases, the increased cases in the Seychelles after vaccine was administered, remain very mild cases. So that's a sign that the vaccine is somehow effective, but it's not completely effective. Listen to what the World Health Organization says, and you can come to your own conclusion.
Back to you in a moment when we have figured this out, and let's start with Christoph Vogt from the AFP. Christoph, please unmute yourself.
Hello, good evening. Thank you for taking my question. This one was on Sinopharm. Who provided emergency use listing last Friday on the Sinopharm vaccine. But at the same time, we saw some worrying reports from the Seychelles where this vaccine was used quite a bit. And still, the pandemic doesn't seem to abate and the numbers are going back up. Can you tell us what's happening there? Is it due to the vaccine? Is it several different factors? Thank you.
Thank you very much. Mariangela Simao, please.
Thank you, Christoph. Let me start, and then colleagues can talk about the Seychelles situation specifically. The Sinopharm has received an emergency use listing by WHO on Friday after an extensive review by an external technical advisory group that looked at different data. We did site inspections in China in January and February. And so the good manufacturing practices, the Sinopharm is compliant, and we also assess the clinical data that's available for Sinopharm. And it was also considered suitable on efficacy and safety and good manufacturing practices. The specific situation of Seychelles, we know that the vaccines we have right now in the market, they don't we still have data proving that they are efficacious against severe disease, right? So there's less data about transmissibility. So I don't know the specific situation of Seychelles, but Sinopharm has been very much used globally. I think it's 62 million doses have already been applied, and it has been considered both safe and efficacious. So I don't know if anyone wants to comment on. I can't.
We're calling out for Kate O'Brien. Dr. Kate O'Brien, the Director of Immunization, Vaccine and Biologicals, who should be online. Kate?
Thank you so much. Yes, this situation in the Seychelles, we're in direct communication with the ministry about this. It is a more complicated situation than sort of the top line messages. As was noted, the vaccines are highly efficacious against severe cases and deaths. There are most of the cases which have occurred are mild cases. However, what is also important is that a substantial fraction, over 80% of the population, has been vaccinated. But as we know, the vaccines after a single dose, the Sinopharm vaccine, really requires 2 doses. And some of the cases that are being reported are occurring either soon after a single dose or soon after a second dose or between the first and second doses. So in general, I think when we see cases continuing to occur in the setting of vaccine, it really does require a very detailed assessment of what the situation is. First of all, what the strains are that are circulating in the country. Secondly, when the cases occur relative to when somebody received doses. Third, what the severity of the cases are. And only by doing that kind of evaluation can we make an assessment of whether or not these are vaccine failures or whether it is more about the kinds of cases that are occurring, the milder end of cases, and then the timing of the cases relative to when individuals received doses. That evaluation is ongoing, and we're supporting and engaging with the country to understand the situation.
Thank you very much, Dr. Kate O'Brien.